Hello there, this is chapter 29, burns. So you've learned about the skin already. Hopefully you understand there's three layers: the epidermis, the dermis, and the subcutaneous fatty tissue. How we grade the severity of a burn is how deeply into these layers the actual thermal energy goes. So if someone has a sunburn, more than likely this is going to be just on the epidermis, the outer skin. It's not really going to cause any scar tissue. It's not going to cause any permanent serious injury or other harm. If there's enough energy and the burn enters into the dermis is, they call this the functional layer of the skin because it has all of the functional units, meaning it has the blood vessels and sebaceous glands and nerve endings and all those things. So now the thermal energy is affecting those vital organs in our skin. If it burns down through into the third layer, the subcutaneous layer, this is called a full thickness, or you might have heard the term third degree burn. And so we grade by the depth of the burn and how it affects the skin. Now, when it comes to the functions of the skin, you've already learned that the skin protects us. It's a barrier from the outside world, from bacteria and other things. But it also carries a large quantity of blood supply in the skin, in our capillaries. And also it helps, along with our hypothalamus, it helps to control our body temperature. So you can imagine if someone has a very, very severe burn that's burnt into the dermis and down into the subcutaneous layer, two bad things will probably be happening. One is their body will lose its ability to control the body temperature, which makes this person more prone to hypothermia or a drop in body temperature. And also because the energy has affected the capillaries in the dermis, the capillaries start to leak plasma, which causes fluid loss, which leads to hypovolemia or shock. Now, the number one concern for us and any burn victim, whether it's chemical burns or whether it's burns by fire or some type of thermal burns, are ABCs. And really what it comes down to is if someone breathes in the heat or the chemicals, it causes edema and swelling to the upper portion of the airway, the larynx. It gets into the lungs, it causes edema, it causes fluids, pulmonary edema in the lungs. It's all going to affect their ability to exchange gases. It's going to make them hypoxic, and it's going to be our number one priority. Realistically, if this person is going to die from their burns immediately, it's probably going to be from some kind of respiratory-based condition. Another concern that we have is that for us to breathe normally, our chest has to expand and contract. That's as the intercostal muscles, contract, the chest expands. So this allows us to breathe in and out. There are these types of burns called circumferential burns. And what circumferential means is it basically means all the way around. And so this person has been burned with partial thickness or full thickness burns all the way around their thorax, their chest. And because of these burns, they can't really expand and contract their chest effectively, so they can't get a good tidal volume, and you can see it kind of doubles down the problem. Circulatory system, like I mentioned, the thermal energy can cause the capillaries to leak, leading to eventually what's called burn shock. And one thing about burn shock is it does take literally hours, sometimes 6, 8, 10 hours to develop. So if you go to a burning, house on fire, or you get called to a car fire, and there was somebody in the structure who was burnt, and they have serious, critical second and third degree burns, and right then and there they're already in shock. So their blood pressure's low, their heart rate's high. That's not burn shock. More than likely, what's happened is if this person has fallen, maybe there was an explosion, they have internal bleeding, and this is actually hemorrhagic hypovolemic shock. This is going to be the cause of this. So this is not burn shock. Burn shock takes hours to develop, but hypovolemic shock only takes minutes. Nervous and musculoskeletal systems. So this is kind of on the other end of it. This is after the fact. You've got the person to the hospital, the burn center, because they have critical burns. And this is why it's so important to take someone to the burn center and get the best possible treatment as soon as possible. What happens with burnt tissue, it scars over. And scars are much less pliable than normal healthy skin. So what happens to these patients, once these burns heal, they can't, whatever part of their body's been affected, let's say it's an arm, they can't straighten their arm out. Everything's kind of locked in place. Or if it's their hand's kind of in a claw shape, and they can't straighten out their fingers because of all this contracture and all this scar tissue. So getting them to a burn center, they can start immediately to make sure this doesn't happen or minimize it anyway by various types of surgeries and skin grafts and things like that. So again, it's really important to minimize this permanent disability this person might have from their injuries. Assessment and burn and care of burn. So this is a superficial burn. You might have heard it as a first-degree burn, and this is just the epidermis. This is the person at the beach laid out too long. They have a sunburn. It doesn't cause scarring. It doesn't cause damage. It's just kind of miserable. It makes them feel kind of nauseated, and they feel kind of cold to the touch and all that. But it goes away by itself. They do not need to be transported. Partial thickness burns, now this thermal energy has actually gotten into the dermis, and it's begun to affect the capillaries. And the blisters that you see on these pictures, that's the plasma leaking from the capillaries creating these blisters. So if you see a burn with blisters on it, that's automatically considered a partial thickness burn, or you can call it second-degree burn as well, if you're used to that. Now, full thickness burns is all the way through all three layers. Usually these are indicated by there's dark charred areas. There's actually white, kind of a white looking area. You can see it in the picture right there. A lot of times the actual area of the burn itself is not painful because they burn through all of the nerve endings all the way down to the subcutaneous layer. The area around it, the second degree and first degree burns that are associated with the other burns, the area around it will be painful, but not the actual third degree area. They need to go to the burn center, get that stuff scraped away, start the healing process, keep that mobility. Otherwise, that the hand will no longer be able to be, or the leg will no longer function sometimes. So the ways we determine severity. First thing is the location. And there are some differences between National Registry, your textbook, and your protocol here in the County of San Diego. Mostly has to do with the actual percentage of body surface area and the severity of the burns. You should compare the two. It'll be really important. We're really concerned about respiratory burns, obviously. We're concerned about serious burns to the hands or the feet, perineum, those areas like that. And we're always concerned about circumferential burns. Again, this could be around a limb, could be around the torso, whatever it is, it causes that stricture, it causes that constriction of the tissues, and it reduces the expansion of the chest, or it could actually cut off flow of blood to a limb because it almost like gets so tight it becomes like a tourniquet, almost an internal tourniquet that reduces blood flow to the limb. And ultimately, of course, because of these burns, they could develop hypothermia, which we want to really prevent by turning the MS at 85 degrees, getting some blankets on them if that's appropriate, and getting them to the hospital rapidly. Now, body surface percentages. This is called the rule of nines. You really need to know this. There's two versions of it. There's a pediatric version and there's an adult version. The big difference between the two, if you look at the infant right there, it's the legs and the head. There's a difference, right? So because children develop from the head down, most of their burn surface area, most of their skin surface is the head and the torso. And then as they get down to the legs and feet, it gets less and less. So you should study this, and you should be able to factor approximately anyway how much of second or third degree burns the person might have. We don't count superficial burns or first degree burns in this factor, only second and third degree burns. Comorbid factors, reasons why these people might not survive their burns. Number one is age. Now, you think about children and elderly people, there's some commonalities here. When it comes to children, they have immature respiratory system, immature cardiac system. Also, their skin is very thin, very frail, easily damaged. You look at it from the other side, elderly people, their cardiac system more than likely isn't running most efficiently. Neither is the respiratory system, and their skin is very thin and very frail. So on both ends of the spectrum, they're highly susceptible to these serious critical burns. They can both easily or more easily develop hypothermia than like a younger, healthier person, adult possibly. When it comes to medical histories, if this person has a cardiac history, respiratory history, diabetes, all these things add up to the fact that they might not survive their burns, whereas a young, healthy person might. Medications. So if this person's on blood pressure medications, these are alpha blockers, beta blockers, these can affect their ability to survive and compensate for whatever's going on. If they're on anticoagulants, those are blood thinning medications. Again, this is another kind of checkbox against them, makes them more prone to succumb to their burns. And if they have these, major burns over a good portion of their body, and they also have internal injuries and fractures and other things going on, all this adds up to a greater chance of them not surviving the burns. So number one thing, if this person is still on fire, if they're still smoldering, stop the burn. Get some water, pour it on them, stop the burning process. Then at that point, it's safe for you, it's safe for them. ABCs, high flow oxygen, hopefully far away from the source of the energy in the burn, or the fire, should I say. And then get them moving to the hospital as quickly as possible. If you did have to pour water on them and stop the burn, you'd want to possibly cut away those wet clothes, expose the area as best you can, dry off what you can. And then we use burn dressings. Burn dressings are specifically used for serious critical burns like second and third degree burns. They don't stick to the wound, and we're not, even though we do consider infection, the biggest thing is the discomfort and the pain. So we wrap these people in these burn dressings, their burns up. And it's not like you're wrapping up a wound, like you're wrapping up a laceration. This is more like just gently placing it over them, covering them gently. It keeps the air off of it, and it keeps the pain, I won't say to a minimum, but it reduces the pain. The difference here when it comes to burn dressings, so if they have less than 10% second or third degree burns to their body, you can use a moist burn dressing to help cool the burn and stop that burning process. If this person has greater than 10% burn surface area of second degree and or third degree burns, we only have to use or can use dry dressings. So it's still a burn dressing, but it's just not any water on it. The reason why this is, it falls back on that hypothermia issue we talked about earlier. This person has 20, 30, 40, 50% burns on their body. They're much more prone to hypothermia. If we cover them in a wet dressing, it's just going to increase their chance of becoming hypothermic. If you do see blisters, leave them alone. They'll take care of that at the hospital. Chemical burns, number one, really, if you look at this picture, this EMT right here is really kind of doing things wrong. They're not protecting themselves from that powder. As they're brushing the powder off, it's more than likely aerosolizing, it's getting in the air, they're breathing it in. This particular product is lime, and lime reacts to water. It heats up in the presence of water. So if you think about what's in your mouth, saliva, what's in your throat, what's in your lungs, you have, surfactant, liquids. If she breathes in this powder, she could have burns to her mouth, her nose, her eyes, anywhere where there's even sweat on her skin, possibly. So again, this would be probably not the most advisable thing to do, but there's a picture right there if you want to know what not to do. If it's a powder like you see here, we're gonna brush off that chemical, and then we're gonna flush with copious amounts of water. If it's a liquid chemical, then we're just gonna flush for at least 20 minutes with this. My recommendation, if this were my patient, and this person were awake and alert, as we see here, I would have him take his clothes off, his gloves off, his pants off, his shirt off, and I would hand him the brush, and I would have him brush himself off, directing him to brush away from himself. And once he got enough of this stuff off, then I would take my water, and I would take my garden hose or bucket of water, whatever I have, and I would then, obviously pour it on the areas that have been affected. Electrical burn. So as you might already know, electricity likes to travel through the path of least resistance. It likes to find the ground to exit your body. We're talking here high voltage. We're talking 240, 480, multi-phase, lots of amperage going on here. So this person's touched something, a 240 circuit, the electricity goes up, and you notice it goes right through her heart and lungs sometimes. So it can stop their heart, and it can also stop their breathing as well. This can also cause thermal burns, like any other kind of burn. It can cause fractures to the limbs. So this is a kind of a multi-phase kind of injury, these really large, high voltage injuries. It can damage your heart, damage your lungs, damage your skin and tissues, and damage your bones. Again, those high energy kind of burns should go to the burn center. Number one priority, of course, is your scene safety. If the person's still in contact with the energy, you're going to have to just wait until someone who knows what they're doing comes and turns off the juice before you can move this person away from that source and to start to treat them. I think we're all done.